Deja, thank you. Polls now open in Missouri. They'll open in just a few minutes in Kansas, about half an hour, 7 a.m. Today's primaries are unlike any you've ever voted in before, thanks to the health conditions that you'll expect to see whenever you head out.
Absolutely. We're in the middle of a pandemic, and this morning we're once again joined live with Dr. Hawkinson from the University of Kansas Health System. So, Doctor, for anybody headed out to the polls today, what should they be doing to stay safe? Maybe these are closer quarters than a lot of people have been in a long time.
Yeah, in order to stay safe during this, it goes back to the pillars of public health and disease prevention that we've talked about for COVID-19. Try to maintain that distance away from other people. 6 feet is good if you can. I know some of those lines can get bad, but 10 feet is better. Certainly wearing a mask is important to protect other people and yourself. And if you have eye protection, such as goggles that you've got for the hardware store for working outdoors, something like that, that's going to be important as well. And then finally, of course, the hand sanitizer. Bring hand sanitizer with you, whether it's the alcohol gel or the alcohol spray. Use that frequently and truly try not to touch your face, especially your eyes, your nose, your mouth, and manipulate your mask.
So, Doctor, there's a new study out from the Journal of American Medical Association, the pediatrics there, that shows children infected with COVID-19 have at least as much of the virus in their noses and throats as infected adults. Obviously, what kids are going through right now as they head back to school is top of mind for so many people. What does that information, knowing that kids may have as much as a grown-up has carrying around, potentially mean for parents and people who are getting ready to be around kids more often, like teachers?
Yeah, that's important. We know that kids spread a lot of disease, whether it's respiratory disease like COVID-19, like influenza or the common cough and cold, or other GI illnesses. We know that children do that or tend to do that a lot more than adults. There was some information from indirect data about household contacts, and it didn't seem as if children were spreading it as much. But the study you mentioned is very good. There's a couple other studies that also show that children can have high viral titers in their upper respiratory tract. So, assuming that they can spread just the same. We still don't know the full answer to that question, but moving forward, it certainly puts a lot of pressure on the schools, the school districts, as well as the teachers, the staff, all to maintain safe practices as much as possible if we end up going back to in-classroom learning, because we know that there have been some other studies that have showed that with the school shutdowns, we maybe saved countless number of other infections and lives. So moving forward, depending on what the climate is in any one community with the infection, and if the school districts and schools decide to go back to school, that is going to have to be one thing that we consider. Have to continue to teach and endorse those safe practices, though, as much as possible and as much as going to be allowed in the school with the distancing and the masks and the hand hygiene.
It's such a complicated process because there are so many other factors related to health that are not about COVID-19. Dr. Fauci talking about this to begin in-person learning, that it might be important to do that. He said, quote, "It's important for the children because of the psychological benefit, and in some places even for the nutrition of children who rely on the breakfast and lunch they get in school."
Yeah.
What do you think about that notion, kind of all of these factors trying to figure out, and he also said, one size doesn't fit all here. Yeah. What do we do?
Yeah, I think we really have to look at, again, the infection dynamics in your community. Is everybody coming together as a collective? Is everybody wearing masks? Is everybody avoiding those large gatherings? I know it's hard to do right now, especially in the summer, but is everybody able to do that to really stop the spread of the disease as much as possible and get those rates of positivity on the tests decreased to flatten or decrease that curve so that we can get back to school? Because right now, really what we're seeing, for the most part around the nation, is continued spread or continued increase in new cases in certain communities around the nation. So the way that we can do that, hopefully, is to everybody come together as a collective, have this culture change, really having everybody do these proper pillars of public health and public health adherence, to really do those things so that we can get back to in-school learning. And it is safe for the children, for the teachers and administrators, and for the families that those children to go home to as well.
Dr. Hawkinson, as always, we appreciate your time this morning. Thank you for answering our questions and viewer questions. Don't forget, Dr. Hawkinson joins us live every Tuesday and Thursday here on 41 Action News today, answering questions on the pandemic. So be sure and watch Thursday morning this week on 41 Action News right around this time, 6:30. Plus, reach out to Lindsay Shively and I on social media. For any questions you want answered, you can hit us on Facebook or Twitter and let us know what questions you have that you'd like us to ask Dr. Hawkinson when he joins us on Thursday morning.